Today we're going to be talking about a very timely topic. The focus is on the issue of COVID vaccination, but we're going to be talking about it through the lens of trust and social networks. So today we're very honored to have our friend Rabia Khan, who is an epidemiologist, which she explained the other day. Finally, nowadays, now even her mother knows what she does. Everybody knows what epidemiologists do these days. And she's the Director of Commissioned Research and Engagement at the George Institute for Global Health in Sydney, Australia. She also worked for several years at the Organization for Economic Cooperation and Development, OECD, as a policy analyst for healthcare quality and outcomes. And then we also are pleased to have Steve Kleiman, who's been a colleague of mine for many years. He's an innovation consultant and former senior vice president for research and development at the United States National Board of Medical Examiners. So thank you, Robbie, and thank you, Steve. Let's get started. We are going to hopefully achieve these objectives. No money back guarantee, but we are hoping that by the end of this unit, you, the participants, will be able to identify fundamental elements of trust and recognize regional differences. 2, cite examples of the connection between social networks and behavior. 3, map the psychology of online relationships to development of social networks. 4, evaluate the relevance of social networks to vaccine hesitancy in your region. And finally, hopefully you'll be able to propose strategies for adherence to vaccine policies that use elements of trust and social networks. So let's get started and talk about the core factors that make up trust. And there are many different paradigms for what trust is, but here's one, and see, you can, as I'm mentioning these items, think about how they relate to your experiences with trust. So one core element, integrity. Simple definition of that is doing what you say you're going to do. Straightforward. Predictability, that your trusted partner's behavior can be anticipated and your consistent behavior can be anticipated. 3, value exchange, and we're going to talk more about this when Steve comes in later, but in trust, there's exchange even when you do not have full knowledge of the other party. 4, delayed reciprocity, giving with the expectation that return will be indirect or at an indeterminate time. Key factor in trust. And then finally, 5, exposed vulnerability. You're able to reveal to your trusted partner information with the expectation that it will not be taken advantage of. And you'll find many other paradigms for trust, but this is one that I find helpful and relatively straightforward. This concept of the ability to predict allows us to feel in control. If we don't know what's going to happen next, we're on the lookout. We're wondering what may happen, what danger may await us. It allows us to make decisions in our best interest. It implies an understanding of cause and effect, and it requires us to acknowledge when we're wrong. Now, just as we talk about the COVID virus and vaccinations, keep these elements in mind: control, ability to predict, understanding cause and effect, acknowledgement when we're wrong. All those factors, I think, are related to trust pertaining to COVID. Now, there's a lot more on trust, and if you want, you can go to this website, and this file and this recording is, of course, available to everyone later. But there's a spectrum of trust. There's blind trust and there's paranoia. Interesting concept of the transaction cost of low trust. If you do not trust someone, you have contracts, you have some accountability process. We also have trust in groups that are, you've got a pre-established group and there's a implicit element of trust. And there's an interesting concept called swift trust, which is when you've got sort of action-oriented teams that are brought together for a very specific purpose with a very short time frame. One example that's often given is throwing together the team that's going to put together on a movie set. Another in my realm of experience might be A trauma team where there's a very specific purpose. Military analogies, of course, also come to mind. So swift trust is another concept. Interestingly, trust is not a homogeneous factor across countries. So this is a slide, and this is from a book that I'll show you the name of later, that has looked at the elements of trust across countries. So dark green is high trust levels, light green is low trust levels, gray is no data. So just keep that in mind. The point here is that it's varied across countries. And as we go further, we might try to see why it's varied. So this is trust in doctors and nurses by country. So it's sort of similar, but you'll notice that there seems to be a little more trust in East Africa for doctors and nurses, or perhaps in southern cone of South America. So it varies. There's an average level of trust across countries. There is a differential level of trust for certain professions. And this next one is kind of interesting, and that is trust in national government. And this is, I think the most interesting thing here is that there's no data from China, which had the highest level of trust in general. But when you start to ask specifically about national government, not so fast. People are much more hesitant. So it varies across countries. And you might say, well, what are the factors that cause that variability? And the book that I was alluding to earlier is called The Spirit Level by Pickett and Wilkinson. And what they describe in this very interesting book are that social factors in your country and mine and others correlate more strongly with internal equality or inequality than with overall wealth. And I'll show you that in a second. So factors like health, infant mortality, teen pregnancy, homicides, mental health, and trust correlate with the unequalness of societies. And let's see how that plays out. I'll show you in a second. And this power imbalance leads to a fear of harm. If you're in a low power situation, you're afraid that the high power entities in your society may be harmful to you. That fear leads to an increased transaction cost that we mentioned earlier, contracts, guarantees, insurance, and finally decreased trust. So just to digest this a little bit here. So on this left-hand side of your screen, those are countries with low inequality. These are very equal societies. So Sweden, Finland, Japan, high levels of equality. On the other end, United States, Singapore, Portugal, low levels of equality or high levels of income inequality. And as that inequality increases, as you go to the right, the number of people, the percent of people who say that people can generally be trusted goes down. More inequality, lower levels of trust. So levels of trust are higher in more equal rich countries. Notice that it's not a matter of how rich the country is. Singapore is a pretty rich country. Sweden's a pretty rich country. It's really the difference in their equality within the society that determines levels of trust. Even within a country like the United States, each of the 50 states has been analyzed in terms of its level of equality. And in certain states like the state that I'm from, New York or Mississippi, those states have very high levels of inequality. States like Utah, New Hampshire have low levels of inequality, and trust also varies across those states. Now, as you think about that data, what I'd like you to do is think about your own environment, your own country. What are the levels of trust in your country, of others in general, of doctors, nurses, health workers in general, of the government? And I'm going to put you in groups of 2 or 3 to talk about that just for about 10 minutes, just to digest some of the things that I've just mentioned to you that I think can be, they're very personal issues. And I think that it's important for you to reflect for about 10 minutes with your partners about how those issues of trust play out in your area. So we have 24, so we'll do 12, so we'll do 10 groups. Let me just, sorry. Breakouts, and the next breakout. Let me turn things over now to our friend Rabia, who's going to talk about social networks. Rabia, you can go ahead and share your screen.
So, good morning, good afternoon, and good evening. I'm hoping, I'm here from Sydney. It is just after 10 p.m. kind of thing. So, if I fall asleep, it's because it's past my bedtime. But hopefully, I think I'll keep you all entertained for the next wee while. So Bill's just been talking about trust and you've all discussed about trust. So we're moving slightly into a different field now, social networks. So that's second part of this workshop, social networks. So quick pop quiz: which one of these following images is a social network? So put it in the chat box. Put it in the
Excuse me,
chat
Rabia, do
box.
you want to go to presentation mode?
Yep, I think I am in
Oh,
presentation mode.
okay, I see slide layout. Okay,
Okay,
there we go.
I can try again.
That's
Um,
right. That's right. Go ahead.
hmm, okay, better now?
That's okay. We see a slide layout box on the right, but that's okay. Don't worry about it.
Okay, very strange. I don't see it. So sorry about that. So if people could put in their chat box, which one of the following images is a social network? I can see some answers coming in. Six. We'll just wait a few more minutes, a few more seconds. Sorry about this. I think my slides have decided to go on its own little trip. Well, would you mind sharing the
Yep,
slides from your screen? Mine have
absolutely.
frozen.
So go ahead and if you stop
I'll,
sharing, I can just
I'll
pick it
stop
up
sharing.
from mine. No
Yep.
problem at all. That's okay. And 1 second. And here we go.
Yep.
And there we go.
Yep. So, thank you. I think yeah, mine's a technology fail kind of thing.
That's right.
So I think people are still coming
Oh,
in with the messages. So we've got, let's see, so far. Yeah, so it is a trick question. It is all of them. So all of these images are social networks. Um, Next slide, Bill. And what do we mean by social networks? So, as you saw those images, we had an image of a family, an image of high school students, an image of professionals. So, they're all a social network. And a social network pretty much is people you hang around with. So, it's a bit more than that. It's a social structure and it exists between what they call actors, but they actually can be both individuals as well as organizations. And they're usually connected by they're connected by, sorry, sorry, my slides just my internet froze. Sorry about that. So they're connected by a specific type of relationship. So they can be friends. It could be family, your immediate family or your extended family. It could be your classmates. It could be your professional colleagues. So that's what a social network is. That there are these individuals and they're connected to each other in some form or the other. Next slide, please. So, what are some of these characteristics of social networks? So, when we talk about social networks, what do we mean? So, in this, when we study them, we're looking at three main factors. So, the first factor, as you can see, those birds, is called homophily. And the proverb for that is birds of a feather flock together. And if you think about all the people you hang out with, you have more in common with people you are friends with than people you're not friends with, which makes sense. You tend to hang out with people you like. You have common interests, you've got common hobbies. You did the same classes at university, or you went to the same high school, you lived in the same neighborhood. So that's quite, and it's not just you, it's everybody around the world. We tend to hang out with people we like, who are more similar to us. And you can see that sometimes in the online world, especially in Facebook and Twitter, you tend to have, you follow people who are more like you than people who use ideas you don't agree with. So that's a concept, and it kind of relates a bit to some of the stuff Bill was saying about trust. So think about that. Who do you trust in terms of who you hang out with? The other thing, I think I've got Kim, I think it's Kim Kardashian. It could be one of the other Kardashians. I can never tell. And the other concept is contagion or influencer. And that is we are influenced by our social networks. So it's a bit like a contagion in terms of behaviors, attitudes, information kind of spreads and across the social network fairly quickly. And that's the nature of the social network in terms of contagion. And especially in the COVID sense, it's quite good to think about it because COVID as the virus has spread across people, and that's why we have lockdowns and social distancing to kind of break that chain. But also in terms of information, when you think about gossip, how um, I think interesting gossip spreads a lot faster than boring lectures, kind of thing, that kind of information. So again, it's about the influencer, it's about the contagion. And the third one is what's called the 6 degrees of separation, or it's also called, it's a really small world. So this experiment was done by a social psychologist, Milgram, in 1967. So this is pre-internet. And I think other than a couple of people, I think most of us were not there in 67. And what he did was he sent these packages to a place in the US called Omaha. I don't know, Bill and Steve, you might know where it is. It's literally, I think, in the middle of nowhere from the looks of the map. And basically, he told these people, you need to get this package to Boston, but you can't send it directly. You have to give it to someone. And in, I think, between 4 or 5 days, the receiver got all the packages, and it took 6 steps, and hence it's called the 6 degrees of separation. That it only took 6 people on average. He did it through a lot of people to get to the package in Boston. And at this time, it was no email. So it was quite hard. He was physically giving it to people, the packages, and it shows how linked we are. They've repeated this experiment quite a few times now in terms of using social media as well as emails. And I think it's dropping, like the whole globe is about 4 to 6 people away from each other. So any one of you might be 6 steps away from who's a famous from Kim Kardashian, for instance. You might be connected to her in some way. You only need 6 friends to reach her. So that those three are quite. They are characteristics of social networks. So when you're thinking of issues about how information spread, you kind of look into these three. Think about these three, and also when in your sessions, think about how trust is in those relationships, especially with the homophily, what trust role plays. Next slide, Bill, please. So another pop quiz. As we know, this session is about behaviors and social networks. So which of the following behaviors, so we've got smoking, voting, obesity, holiday destination, and vaccination, do you think is not affected or influenced by your social network? So if you could put it in the chat box. So you can type in which of these behaviors. I think we've got one. I know I've worded it in a very tricky manner. Okay, so it looks like I don't even know why you guys are attending this workshop. You seem to know the answers, all of you. So that's correct. All of these behaviors are affected by people's social network kind of thing. And the way they do it is, and even a holiday destination, and all of them actually, you'd be surprised. People have done research studies to show every one of them. And if people are interested, I can send them the research journal article, even the holiday destination, how they're related to your social network, that behavior. So we're not as independent as we like to believe. Next slide, Bill. So one of the main things, as I said, all of the, even the holiday destination, is social networks do influence people's health. And as we were talking earlier, they can be through disease spread. So viruses, like actual physical viruses or bacteria, can be spread through people. So and this has been happening for a millennia. So the plagues in the Middle Ages, as well as the various outbreaks. This 1918 influenza pandemic, and now the current COVID pandemic, your networks influence it. So that's when contact tracing come in and things like that, because you're looking for who has this person been in contact with, and you generally are not in contact with people you don't like, kind of thing. So that's one of the ways of thinking it. But it's also things like opinions, behaviors, and resources. So what do I mean is like how we get our information. It's through our networks. So sometimes it could be information if, say, one of your lectures have been cancelled for the day, and sometimes you might only have to tell 2 or 3 people, and within 5 minutes, everybody knows because everybody's WhatsApped each other or put it on Facebook. So again, that is how information gets spread. And also sometimes it's things like diffusion of innovation. So when you've got a new innovative thing, if your friends just bought the new iPhone and said it's the coolest thing ever, you're more likely to go and buy an iPhone, the newest one, because you've got that, someone's told you about it. And sometimes it's even resources. So for instance, if there's a job ad or an advert or a new scholarships up for offer, you're more likely to hear it from your network, because someone might say, hey, Bill, there's this job going. It might be a perfect match for you. You should apply for it. So again, it's about your networks. So all these things influence behavior. So it's not just and it's, of course, it will influence health. Next slide, Bill. So when we talked about all these behaviors, things like, some of them are quite obvious, like smoking, for instance, because if your friends smoke, you're more likely to smoke if your friends smoke. But what's been quite interesting, especially in the last 10 years, as vaccination rates have come down and we've been getting these pockets of outbreaks, is people have been starting to look at why aren't people getting vaccinated? These are quite, I mean, it's a miracle drug. It's saved millions of lives, but people aren't, the vaccination rates are dropping. And one of the things that play a role in this are social networks. So there's this study was done of health professionals. So they were young graduate medical doctors in the UK, and they basically wanted to know who got vaccinated, and they looked at they asked them about their friends, and then they checked whether their friends got vaccinated or the people they hung out with, as well as their colleagues. And they found one of the biggest factors was whether someone was vaccinated was whether the people they hung out with quite often also got vaccinated, both their friends and who are medical doctors, but also their colleagues who are medical doctors. So even with health professionals, there was some kind of, the social network played a role. You're more likely to get vaccinated if your colleagues are vaccinated. They did a similar study with parents with young children, and this is a US study. And this one, they were looking much broader. They wanted to know what were the factors that predicted whether a parent would get their child the routine childhood vaccination or not. So they kind of divvied up them into groups. And what they found was in parents who did not vaccinate their children, they were more influenced by the people in the network who recommended non-vaccination than the parents who did vaccinate. So one of the biggest things was if the people and these was their friends, family, colleagues, if they said don't vaccinate your child, they're more likely to not vaccinate their child. Whereas it didn't really seem to matter with the people who did vaccinate their child. So they were hanging out with people. So again, people were hanging out and listening to people in their little networks. And the last study was looking at young adults who with HPV vaccine. So it was a systematic review done looking at why HPV vaccine rates weren't as high across Europe. So what were the factors? And one of the factors for young women was there were the big thing that made an affected their vaccination decision was whether the advice from trusted family members, but also their friends and peers, excuse me, if their friends were getting the HPV vaccine, they were more likely to get it. But if their peers weren't, then they were less likely. And to them, that made a big difference, as well as family members. Next slide, please, Bill. Yeah, the breakout things. I think I didn't time myself. So I hope that gave you a bit of a taste of what social networks are, and as well as how they influence behavior. There's a lot of literature out there about it. And I think the couple of pre-readings we had by Christakis and the TED Talk, they kind of talk more about the obesity side of things as social networks. So there's a lot of literature. But for your breakout room, I think we've got 3 questions here, and that is, the first one is how social networks have influenced your behavior, and it could even be your holiday destination, but it's think about how they have. And in the region, in your region, or in the context you are, so if you're working in a healthcare setting, how have social networks influenced vaccination acceptance? Thinking about what I've talked about, but have you seen something similar in your own setting? And lastly, to just identify 2 or 3 common examples in your breakout group of these things.
Excellent.
Have I got that right, Bill?
You got it right. And let me, I will also send a reminder through the broadcast. So let me, we're going to put you into groups of about 6 or 7 folks, and you'll have about 10 minutes to discuss these issues. So let me, tell us what you talked about in your group and perhaps some common examples that came up across your countries or regions. So now, the other thing I forgot to mention at the start is, at this point, please do turn on your video camera if you have it. That way we can interact more meaningfully, and I see that everybody's got their actual name in the label, so that works. Okay, thank you, Ryan, for turning on your camera. Appreciate that. Now I see some very familiar faces, and I'm going to try to avoid calling on those people because we've heard from them in the past, and I know they have great things to say. So I might just dig deeper here into the people that we haven't heard much from. So. Actually, Ryan, I'm not saying your name right, Rayon, maybe you could tell us what your group talked about. First of all, tell me how to pronounce your name. And you have to go off mute.
Okay, yeah, it's Ryan.
Ryan, okay, I was close, good, okay. What did your group talk about, Ryan?
Okay, I was in a group with Yasin. We discussed the idea that some friends and family members, especially those family members from medical background, can influence our vaccination taking, our method to take vaccine or not. And Yasin was telling us that the trust is a major factor that could influence the people decision in life and these things. I gave an example, and it was like something very, very clear for me when I saw the social network. Few months ago, when we started the vaccination here in Sudan, a very famous person from my college, he is a senior of us. He took the vaccine, and then he posted that. He take it, and he advises other people to take it. And 2 weeks later, I was talking to a colleague of mine. She was saying that she took a vaccine, the vaccination, and I was very surprised because she was like against COVID, taking against the vaccination and everything. And I asked her why you take it. She said that because that famous person took it, and he posted on his social media accounts. So that's it.
Thank you. That's great. Now, Ryan, I'm going to give you a big responsibility here. I'm going to ask you to pick someone that you can see on your screen that was not in your group to give the next response for their group. So find a name on the screen, someone you either know or don't know who wasn't in your group, and you've got the responsibility to call on them.
Okay, Mustafa.
Okay, Mustafa.
I knew she was going to pick me.
There you go. Secret insider information there. Okay, a little social network action.
In our group, actually, I was in a group with Ariel and Itidal and Benazir and Janet. Okay, quite a number. And I think one thing that was common is that it's becoming of very great significance is the social networks. I mean the social media, because with the vaccination uptick, especially like in Indonesia and in Mexico, it's actually positively improving vaccine uptick there. And I think that's something that stood out very much for me. Yeah, social media is actually playing a very big role in terms of influencing behavior right now. Yeah.
And which country are you in, Mustafa?
Oh, sorry, I didn't mention that. I'm from Nigeria, actually. Ariel from Mexico and Benazir from Indonesia, Janet from Kenya. So there was that similarity. Yeah.
And Ryan, I missed your country. Which country are you in?
I'm from Sudan.
Sudan. Okay.
Sudan.
All right, Mustafa, big responsibility here. Pick on someone who is not in your group to offer the next bit of feedback or response.
All right, let's see. Okay, I'll go with Noha because I know
Noha. All right. We often hear from Noha, but Noha always has interesting things to say. Noha, you go ahead.
As I'm here, I'm sorry, just I can't turn on my video. So I was in a lovely group with a lot of people. I don't want to mention names so that not to forget everyone. So we were also talking about that, of course, the social networks affect everything. And even sometimes people just when they decide to go to holidays, then they search Google or even ask their friends or their close people, then they can change the destination easily based on their social networks, and also goes with the vaccination. So it's very affected in almost all the countries. We had people from Sudan, people from Indonesia, that the vaccines are very influenced by the social media and by the side effects and what people post. And there was something that is kind of interesting when we first thought that sometimes we ask ourselves that if we are in control of fully in control about our decisions or not. And then we found ourselves that eventually, even when I say that I decide to go to this place or my holiday, or when I say that I want to take the vaccine or not, but eventually when you dig in this part, you find that no, you're not actually the primary influencer of this, because even if you choose to go to a place alone, you just think that, oh, how did I first encounter this country? So it's when I saw it in a movie, or when I saw it when I was just searching Facebook or something. So eventually, everything is affected by our social networks, even if we thought that we are the influencers or the primary people who decide that the decision is ours. No, the decision is not based on you only. This is what we're talking about in the group. Thank you, Bill.
Yeah, thank you, Noha. Volunteers, anyone I see some very faces that look like they want to say something. Maureen, I don't know if I'm saying your name right. I think you're from Guyana. Jerwin, hey, you. How do you say your name? What's the right way to say it?
I'm from Belgium. My name is Jeroen.
Jeroen, I was close, right? I was a good guess. Okay, go ahead, Jeroen.
I was in the group with Noha. So the things she said were the things we discussed. But I also have an example. I'm a nursing student, and 2 weeks ago I went as a volunteer to the vaccination center to help with the vaccinations. And I had, on this particular day, I had to vaccinate with the vaccine of AstraZeneca. And I had 3 or 4 people who didn't want the vaccine because it was AstraZeneca. And when you ask the people why they make that decision of not wanting the vaccine, it always they always say, yeah, people say it's bad. People say you have lung injury, you have lung problems. People say you will die from it, and all these people are influenced by social media, by news sites who aren't fully legal, or so especially now in these times, the vaccination strategy, people are very influenceable on taking the vaccine or not.
Thank you, Erwin. Other comments, other people who would like to comment? I'm not going to call on anybody else, but I know that some of you are very vocal. I'm just going to look in the chat and make sure I haven't missed anything. Okay. All right. If there are no further words of wisdom, thank you, Ryan, Mustafa, and Noah, and Haroin. And let's move on. And at this point, I'm going to ask Steve if you wouldn't mind sharing your screen. If not, I can do it. But if you're all set, Steve is sharing, and all set to go. So take it away, Steve.
Is that visible on screen?
It is visible.
Great. Good morning, everybody. I'm Steve. It's a beautiful sunny day here in Philly. I'm delighted to be here with you. So I'd like to talk about how we can map the psychology and actually more specifically some of the biology of online relationships and developing social networks. And I love this cartoon because I think it says a lot. Your engineering experience looks great, but your social media score is nearly zero. You have no friends, no followers, and no social influence whatsoever. It's because I focus on my work. No, I'm pretty sure you're dead. And I think this does say a lot. We have online lives, and it seems like if we don't have online presence and relationships, we're not alive. But what can we do to understand those relationships and how it differs online? And I'd like to just start with an overview, a couple points, and I'm going to circle back to these over the next 10 minutes. And first, certainly there are classes of theories that describe how we develop relationships, and I'll mention a few. But perhaps one of the most important points is that biology does really drive much of how we develop relationships, and we need to be aware of these effects and even defend against them. So as an example of just the power of biology, and some of you may know this, women can smell whether men have a complementary immune system. This was the so-called sweaty t-shirt study from Wedekind and others in 1995. Women preferred the smells of men's dirty t-shirts when the men had a different immune system gene than them. And there's something else about our biology, about how we develop social networks. And a lot of you may know that we have two small almond-sized collections of cells on each side of the brain called the amygdala, coming from the Greek word for almond. And we seem to reach a limit of about 150 for the number of social contacts we can functionally maintain. And this number seems to be based on the size of those two little almond-sized things. Other primates have social connections, and the number of their social connections increases as the amygdala size increases. We also tend to divide our social connections into in-groups and out-groups. Rabia mentioned some aspect of this. In-groups tend to be exclusive, typically small groups with a shared identity. And this is the so-called social identity theory by TUFH and others. But we seem to be programmed evolutionarily to distinguish us from them. And this has implications because we recognize faces better for those in our in-group. And as we heard before, we're also differentially influenced by in-group members. And there are challenges as we try to deal with this. And it's not just that our biology drives us, but as we'll see a little more in a second, that companies have figured out how to capture our attention based on this. As an example, why do you think that cereal companies, when they advertise with pictures of cereal, place the spoon to the right side of the cereal bowl more often than to the left? Well, it's because they've learned that our brains are more attracted to high density calories. And for right-handed people, the large majority of population, they'll respond more to a bowl with the the spoon on the right, where they can pick it up and scoop it up. It makes the calories more accessible to our brains. So as we'll see, social media companies have learned some of these same tricks. So what can we do? Well, we need to raise our awareness of these things that are happening, the biologic drivers, how online companies and apps are trying to trick us as well to capture our attention, and see what we can do about it. So, certainly there are a lot of relevant theories that we can dig into on how friendships develop, romantic love, how social networks build, and even how societies build. But somebody once said of models, and I think it applies here, is that all models are wrong, but some are useful. So where can we sort of pick and choose and begin to build better lenses to look at those online relationships? And a couple other things I'd mention just quickly about how there is a literature around online psychology and how online relationships differ from in-person relationships. So for example, being online may be very different for shy or reclusive people. And there's also ways that we behave differently online. For example, the so-called disinhibition effect, where we may share more online than we might in in-person relationships. One other theory in particular that I would call out is social exchange theory. And essentially it says that human relationships are formed based on a cost-benefit analysis, essentially that we just weigh what's the benefit and what's the cost of entering into it. And it has its roots in game theory, in economics, in psychology, and in sociology. And just two applications of this that I would mention as examples. And again, these are just lenses whereby we can look at relationships that we developed. And I thought this was interesting because when you can think about when you're developing a survey that you want people to take, you're trying to develop a relationship with somebody. So what this group did was to say, well, let's think about the development of surveys as the development of a relationship. Use social exchange theory to say, well, what's the cost for the person who's going to complete the survey? What's their reward? And what's the trust level here? This trust issue comes back in. And if you're developing a survey and you want your response rate to go up, lower the cost, the amount of time that it takes for them, increase the perceived reward, and increase the trust. So again, this is just a lens that we can use for something that we might not have thought where there's application. And maybe something closer to what we're thinking about is, in this study where they looked at knowledge sharing in online communities and using social exchange theory as a framework for thinking about it. What's the cost of sharing information and the cognitive costs, the executional costs, and how can we think about the benefit of reputational value, the social network that might be developed? And this is another way that there's an application, again, a lens that we can look at online relationships and how we share information in the world and influence people. One other just maybe framework that I'd offer is just what's the information bandwidth in our relationships and how we build them and maintain them. And we could think about bandwidth going from very low, where we just have text messages, building on up through emails and letters where you can hear the experience, see faces, see body movements, and even smell. So we could think about low bandwidth to high bandwidth. And we should be careful with this because low bandwidth doesn't mean sort of a weak attractor or relationship. That is, for any of you who post or have followers, you know how powerful it can be when you start getting likes or you start getting a couple followers. And what happens is that there's some biology that creeps back in here that we should be aware of. And that low bandwidth doesn't mean sort of a weak effect or transaction. And this is where we need to just harken back to Descartes, je pense donc je suis. I think, therefore I am, or my sort of loose translation, I secrete and neurotransmit, therefore I am. And a lot of you are certainly familiar with some key hormones and neurotransmitters that affect our performance and what we do and how we behave. So, and just quickly, I think we know that all of these hormones are circulating and neurotransmitters in all of us, but they can change us. Certainly the studies done showing that higher testosterones lead men to riskier financial decisions. Different levels of circulating estrogen and estradiol can influence in cultures where it's allowed how much skin women will show at different times of the month and how tight clothing is. Let's jump over to oxytocin, which really gives us feelings of trust and empathy and promotes bonding and reduces stress. Vasopressin, which promotes vigilance and guarding of others and territory. And in the middle, we have serotonin, which is involved with anxiety and happiness and mood, and it's part of the reward system. Norepinephrine, which is released when we're attracted to something or somebody, and dopamine, one of the key neurotransmitters in the reward system. And lack of it causes Parkinson's disease. Perhaps you know some people who've had this where they have slow movement, not much facial expression, but it's also part of their pleasure and reward system. And it makes you want to repeat something when dopamine is released. So why do we need to be aware of these things? Because technology companies are aware. They're playing with this. That is, social media notifications actually increase dopamine release. When you get likes, there's activation of that reward circuitry. And particularly when there's intermittent sort of reinforcement, it gets your attention and you want to keep repeating that behavior. And to the point where Facebook has actually done research on the like button. What's its color, its placement, its size, and they try to optimize that to affect your brain and attract you back to that app. Maybe just one more framework that I'd offer in terms of how we can think about our relationships. And I've just created an arbitrary continuum here on what's the purpose? What are we trying to accomplish with our relationships, online or other? And we might think of, you can create your own continuum here. But at some points, there's greater social bonding with so-called attachment. And we can think of the other side of that continuum where it's maybe more of a commercial relationship where there's affiliation. And we could probably pick some things in between that represent our motivations, the things that we're trying to accomplish in those relationships. And some theories point out that there are other aspects of our relationships, different axes that we can think about. How intentional are we in trying to seek those relationships, or we just find them along the way? Is there, are a lot of the people in those relationships, are they like us or different from us? Are these small groups or relationships exclusive? That is, we only let people in on certain criteria, or are they inclusive where everybody can come in? Are there power gradients? Do some people have greater assets in that relationship and greater power? Is it more focused on self or altruism and other? And is it does it have a feel that's friendly, or is it more negative, or is it something in between or combined? So again, some of the purpose here is just to offer some lenses and frameworks for us to think about how we might then think about these relationships. And again, leaving with questions before we get to our breakout. What are we trying to accomplish? What are our objectives and motivations? And how can we be just aware of the biology, the psychology, and make sure that we're not being controlled, but rather we're taking control and figuring out how we might take steps to meet our objectives in the best way. So Bill, would you like to take it from here?
Sure. So thank you, Steve. That was terrific. And now think about what Steve has just talked about and ask yourself and talk in your group about the extent to which your online relationships overlap with your in-person relationships. And then consider how your online relationships are different or the same or similar to your in-person relationships. So do they overlap, and how do they differ, or how are they similar? So we'll go into breakout groups now, and let's see, we got 27. So we will take recreate, and we will make 4 groups. Okay, any questions before we start? All right, ready? Steady, go. From the team, thoughts about how your online relationships might vary from your in-person relationships. Tartil, are you signaling that you'd like to say something? I just saw your thumbs up there. Maybe not. Okay. Benazir, you look like you're about to say something.
Okay, so I was in a breakout room with Tartil, and there are a lot of people, and also not everyone is explaining their experience, but Tardil is explaining that she actually really thanks to the social media because she can achieve her goals because of social media and also connected with a lot of people. And yeah, that's it from Tartil. And for me, I think what makes in-person relationship versus social media relationship is because we can't really express the emotions of what we are trying to say. So yeah, it's kind of difficult and tricky using social media. That's what is my experience about. And yeah, that's it from my breakout room. Thank you so much.
Benazir, which country are you in?
I'm from Indonesia.
Indonesia, okay. So a lot harder to express emotion on social media. Okay, Benazir, can I give you the awesome responsibility of picking someone, calling on someone?
Oh, okay. So maybe I'll pick Brian.
All right. Ryan, you're getting picked on a lot today.
Hi, Vinna. Long time we didn't meet.
A long time no see.
Okay. We were talking in my group with Noha, and they were having an idea that the social media influence, like it has a very disadvantage stuff because they prefer the in-person contact. They didn't prefer like talking to people on social media, and they believe that it's like something that separates from each other. And I disagree with them. I was saying that from my personal perspective, it helped me a lot. I make a lot of friends from the social media, and then when it comes to the real life, we established a very like long-term relationships and friendships. I have a friend from Facebook, and she was, and we were friends for 5 years. And I only know her from Facebook, nothing else. And she is very good friend. If I compare her with other people I already met in my surrounding and college and everything. But I believe nothing is right or wrong. We can stay in the middle. We can start our relationships or wherever, friendship and anything on social media. And then we can proceed on the real life and see if it works or not. So this was like the conclusion of my team.
Thanks, Ryan from Sudan. Who else would like to offer some commentary? Quiet group. And the usual suspects who are paying attention. Yassine, go ahead.
Okay, I'm not sure if you can hear me, but let me know if you hear any cutting or my voice, because I have a network connection problem. So just building on what you've shared from my personal experience as well, I think that online relationship is quite different from in-person or physical relationship, because at the end it comes to the building trust and communication and interpersonal skills and communication tools. So online relationship is lacking some few tools like body language, facial expressions, emotional expressions, not only just like chatting or texting or something like this. Even the virtual meetings, it's something different than the physical ones, because you don't have to touch or feel all of the 5 senses that you have and to share all the emotions or insight from yourself. The second thing is the social media platforms or the social media world that acting as a community to share or to establish friendship, ongoing relationship, romantic relationship, or whatever that we call. It's something also like the social content that you share on your personal profile or personal account that gives the others a specific impression or a first impression or a picture about your personality and about the thing that you shared. It's also affecting the relationship. So sometimes life situation you cannot I mean sometimes you get disappointed, you get your first impression change because when you contact them virtually or even texting, you're gonna find something different in their real behavior, their real action in their life, situation, experience, thing. So it's very difficult, and it's not difficult. I mean, it's very different for me, both physical and emotional. But something, it's some thing you need to advance a stage from like virtual online relationship to physical ones, and then after that.
Okay, I think that was the end of what you were saying. So a little bit different from Ryan's concept, even though you're both in Sudan. Uh, uh, so yeah, they're different and they're difficult and they can be challenging. But on the other hand, as Ryan points out, they can be quite useful and meaningful. Fair enough. Let's move on. We now are going back to our friend Rabia. And Rabia, would you like me to do the same share, or do you want to?
Yeah, I think my thing's still updating,
No
unfortunately.
problem. So let me take us to, there we go.
Okay.
Good? Yeah.
So I think this is the last lot of slides. So I
Yep.
think all of you we've gone through trust. We talked about social networks in general, and I talked about it, and then Steve's talked about online relationships and online social networks, and you guys have just been discussing all about these various aspects. So now we're just bringing it all together in terms of social networks, trust, and vaccine hesitancy. So I did mention vaccine hesitancy a bit earlier. Now we're just going to go into a bit more detail about it and how they all kind of fit together. Next slide, please. So what is now? I think a lot of people think that you've got people called anti-vaxxers and vaxxers, and depending on which group you're in, you think the other person's nuts, kind of thing. But I think what we're realizing is that vaccine hesitancy, like most things, is a spectrum, and that we don't have people who are in. I mean, there are people in one camp or the other, but it's quite rare that people are in one or the other. So, for instance, that's why they've got the term vaccine hesitancy. So, you've got people who would accept all vaccines, and regardless, so they will, and generally they tend to be people in the healthcare workforce, but not always. But they will, if there's a vaccine out, they'll line up, they'll get it done. And then there's a group of people who would refuse all vaccines. So these are what we would call the anti-vaxxers. So they're the ones who would say, no way, never, kind of thing. And they generally tend to be the ones in rallies and protests and things. So they refuse all vaccines. But there's a big group in the middle, which are called vaccine hesitant. And we've seen this in a lot of different types of vaccines. So we've seen that with the annual influenza vaccine, pneumonia vaccines, even measles, but where as well. But in COVID, it's become a bigger issue because all of a sudden, it's a vaccine we're not getting as a child, we're getting as an adult. So it makes it a bit different. And what the vaccine hesitant group is, there's a group that they refuse, but they're not unsure. So they're not totally anti-vaccine, but they're more like, I don't know, I'm just going to wait till another 5 years and all until I'm not sure yet, kind of thing. Then there's a group that is delaying and they refuse some of the vaccines. So they might be saying, I may not get the influenza vaccine annual one, but I'll get the COVID one because we're in a pandemic. So it's a bit of, they kind of pick and choose the vaccines they want, kind of thing. And then there's a group that is, they're accepting but they're unsure, and I think this is quite a big group in for COVID more so than anything else, where they're like, yeah, I'm gonna get the vaccine, I'm happy to get it, but not this very minute. I want a bit more research done, and I think it's very country dependent. So one of the interesting things about vaccine hesitancy is it varies also across country what proportion of your population is in that group. And you can see that even with the current vaccination rates. I think the UK and the US have one of the highest proportion of their population vaccinated, and a lot of countries I know do not have the vaccine, including here in Australia. I think we're still waiting, and I think a lot of people here are still waiting for the vaccines. But in countries where there is availability of vaccines, there are empty rooms to be, and people aren't getting vaccinated, and there might be, they refuse all vaccines, they're kind of sitting in that middle group of vaccine hesitancy. Next slide, please. The good thing is that they've been doing these global surveys for a while now. I think for the last 6 or 7 months, there's a COVID-19 behavior tracker. So if anybody's interested, just Google that. It's actually quite interesting to see what the whole world is thinking. And they've been doing a survey, a global survey from all over the world, asking people these questions every few months to see how we're tracking. And one of the questions they asked back in November last year, so just before the vaccine, and then January 2021, and they was basically asking, I would take a COVID-19 vaccine if it were offered to me this week. And what they're finding was that the trust in that vaccine is increased. So back in November 2020, I think it was only 30% strongly agreed to getting the vaccine. And in January 2021, it's 40%. So that's interesting that it's increasing. But if you look at strongly disagree, it is decreasing, but it's over 20% of, in some case, maybe 30% of the population globally is saying they would not take the vaccine. So you can see the vaccine hesitancy in that kind of the different colored things as well. So the trust is growing. People are less worried as we are seeing vaccination rates are going up. But unfortunately, next slide, please. It's not happening in all countries. So this was a study done to look at vaccine confidence, and they were looking at the barriers to vaccine uptake. And it's very small. So I recommend you going on to that website, to the link to see it. But what it basically was showing that over time in some countries, vaccine acceptance has gone up, and as well, but also vaccine hesitancy has gone up in other countries. And this also varies by age group. So in different countries, different age groups tend to be more accepting or more hesitant about vaccines. So you don't have, it's not a, vaccine hesitancy is a global thing, but what it looks like on the ground in each country is very different. And even within each region, it'll be very different. So if you kind of think of your own country, where you are based, you might know there's some pockets where there is very low vaccine acceptance, and some pockets where pretty much everybody will get vaccine, and also some age groups and things like that. So it's just kind of important to think about when you're thinking, because we're going to start bringing in, what does this mean? How do we reach these people? And what does it mean about trust? And what does it mean about the social networks, especially when you're looking at the different age groups? Next slide, please. So it's about trust and social. So they always say, so in public health, you've got the 5 A's of vaccine uptake. So, and I think it's quite a good way to remember if you're thinking about vaccination policies or vaccine uptake, is the 5 A's. So the first one is access, and it's the ability to get the vaccines. So I know in a lot of countries, the vaccine is not available, and there being issues and things like that. So not everybody has the vaccine, but that's one of the things, is getting the vaccine to the individual. The second one is affordability. Again, how much does it cost? And that is quite a complicated issue. I don't know if people have been watching the news. It's got a lot to do with patents and costs and lots of things around it. But again, it's more about who can afford the vaccine and how much does it cost. But the next 3 ones, Awareness, acceptance, and activation are very much to do with what we've been talking about for the last hour and a half. So awareness is the knowledge for the need and the availability of the vaccine, the objective benefits and risks. So that's what we've been talking about so far, is how, whether you trust someone, who these authorities are in terms of your awareness, and who your social networks are, that will lead to either increase or decrease awareness of whether the vaccine exists and if it's a real vaccine, because that's the other issue. People think they're not real. The other one is acceptance, how whether you accept, question, or refuse a vaccination. Again, very dependent on social networks, online relationships, social media, trust. And the last one is activation, to degree which individuals are nudged towards vaccine uptake. And I love the example that I think one of you, can't remember which one, sorry about that, gave that this person got the vaccine because a very famous person was on social media getting them, who had the vaccine. So they're like, oh, famous people, I'll give it a go. So they just needed that nudge. So that's that kind of activation. So these are the 5 A's of vaccine uptake. And I find them, they're very useful, because sometimes we kind of get stuck in one or the other, and we kind of just go down that alley, but not thinking that you still have to deal with all the other A's in the vaccine uptake. Next slide, please. But what it comes down to is that vaccine hesitancy is in part, as you saw, the three out of the 5 A's is about trust. Who do we trust? And I think those maps that Bill showed at the beginning in terms of people, who people trust. So it could be the government, how much they trust or not trust the government. It can be your healthcare workers. It can be the public institutions. It can be your family, your friends. Who do you go for information? Who do you trust when they say the vaccines are safe? And sometimes it's religious leaders, or sometimes it's even social influencers, famous actors kind of thing, and actresses could be people you trust. And so who you trust is quite an important element, because people are more likely to do something if it comes from someone they trust. And a lot of things that's been happening, especially with the COVID vaccination, the COVID pandemic, is there's been a lot of spread of misinformation via social media. It now even has a name. So if you want to Google, it's called infodemic. There's too much information out in the world in terms of social media, and this kind of distorts the picture, and people start believing in conspiracy theories. And what it does is it erodes the public's trust in governments, in institutions, in healthcare workers. I think, I don't know, I know in some countries, I know even in Australia, there was a lot of, especially the beginning of the COVID pandemic, there was a lot of mistrust against healthcare workers because they thought they were spreading the disease. So people were being actually quite awful to nurses and doctors who were taking public transport, that they feared their lives, even though at that time Australia didn't have that many cases, but they did fear their lives, so they wouldn't wear their scrubs on public transport. They would go to the hospital and change, because people had lost trust in the healthcare workforce. So, and it was a bit of spread of misinformation. So I think that's quite a key thing, because it kind of builds into everything that we've been talking about our online relationships and our social networks, is who do we trust? Because I think more so than a lot of things, I think vaccine hesitancy is very much about a trust issue. Next slide, please. So now we've been talking about vaccine hesitation, and one of your tasks after this is going to be thinking about a vaccination program. Like how would you, it's one of your learning objectives is about a vaccination, adherence to vaccination strategies. And I always think with vaccines, there are 2 different bits of it when you're thinking of a strong vaccination program from a public health point of view. And there's one bit we're reasonably good at, is the logistics, the distribution, the monitoring. So this is trying to get vaccine A to destination B, getting it unpacked, making sure that's the cold storage, that's how do you get the cold chain, how do you distribute it, how do you monitor that people are getting it, it's all those things. And I think as health people, we're very good at it. We're very good at getting people jabbed, kind of thing, getting the jab to the people, getting them. Most of the time we do a reasonable job, sometimes no, but most of the time we're very good at doing that. And that's what we learn. I think a lot of you have learned about that. You study that. We've got a good system in pretty much all countries. We can get to it. But the issue is, and I think more so in COVID and also in other vaccines more recently, is one of the overall success does depend on where and how information about the vaccine safety and efficacy is communicated. You can have the best vaccination centers, you can have the vaccine there and then, but if nobody shows up to your clinic to get vaccinated, then you don't have a successful vaccination program. So I know in a lot of countries, especially in Europe, they've got vaccines waiting, but they've, if you think it was in France, they've got these photos and of these massive vaccination centers, but there's nobody there, or there are 4 people, but they've got 500 seats for them. And I think that's a picture from one of those vaccination clinics, because people are afraid. They don't really trust the vaccine. They don't trust the safety and the efficacy. And a lot of it's to do with, you need to engage with, and you have engagement with and by the public. And we need to kind of not, when we think about vaccination programs, not only think about the logistics, distribution, and all of that monitoring and affordability. They are important, but also to start thinking about how do we engage with the public? How do we increase that trust level? And how do we decrease that misinformation that's being spread around through social media and things? And it's not just social, sometimes a lot of times it's things like WhatsApp. If people, I mean, I was talking to a family member who was, and it's a younger family member who was trying to explain to me why vaccines were bad, because they were like, oh, but it's the way the government's going to track me if I get the vaccine. And I said, well, the government already can track you if they wanted to. And they're like, what do you mean? I'm like, cell phone, you're carrying a tracking device. They don't need a vaccine to track you. They're very horrified, kind of thing. They're like, oh my God, the government can track me? Kind of thing. I'm like, they've always been, if they wanted to, they can. They don't want to, kind of thing. I had another colleague and friend, and I'm sure all of you have heard these conspiracy theories who were saying, oh, the aim of the vaccines to make me dumber. And I had to say, no, I think you're already there, kind of thing, stuff. And it was really bad thing to say, but I said, you're already there if you think the vaccine is going to make you dumber, kind of thing. But these are these kind of myths. And I think as healthcare workers, sometimes it is our job. It's a side job, I guess, side hustle, to dispel some of these myths, depending if it's safe to do so. I always say if it's safe to do so, because some people do not react very well when you tell them that no one's trying. It's not a 5G conspiracy. But I think that might be the last of the slides.
Yeah.
I think, yeah.
Yeah. So hopefully this workshop has made you smarter, not dumber. We unfortunately don't have a vaccine that can make you smarter, but we don't have time for this breakout, but I do wish that you would think about what types of vaccine adherence strategies are relevant in your region and how you would make them most applicable to your context. So just do think about that on your own. Thank you for your attention over the last bit of time. We've talked about 4 major concepts. First is trust, which we characterized as consisting of integrity, predictability, value exchange, delayed reciprocity, and exposed vulnerability. We also talked about how health behavior is influenced by information, emotions, resources, many of which are related to our connections with others. And then there's the psychology and biology of online connections. And it's related to value exchange, it's related to purpose, and as I mentioned, the neurochemistry that we all have inside ourselves. And finally, vaccine acceptance is a complex phenomenon. It's related to all of the above, and there's probably not a single answer or solution, but it certainly involves communication and open discussion with others. So that's the summary. There is homework in this last session. It's very lightweight. What we'd like you to do is to identify a heavy online media user and ask them how their social media interactions may have influenced their willingness to get vaccinated. A heavy user, and how have they been influenced in vaccination use? And then if you can find one, and it might be a little tough, but it may be your grandmother or someone from an older generation, or someone who is a minimal, at first I said non-user, but there's probably none of those, a minimal user. of social media and ask them how their social interactions may have influenced their willingness to get vaccinated, and look at the differences and similarities. And then you'll be discussing that next month in your groups. Now, one final issue, and that is iSTEP needs you, needs your help. We will be distributing a survey in the next day or two that asks you, what has worked in this program and what could be better next time. So we really, next year we'll be offering 3 courses, and we want to make it as the best possible course experience as possible. So you'll be getting this link. You don't have to copy it down now. You'll be getting this link. Please do answer it. We're asking you to respond in the next 2 weeks. And then our next session next month will not be a didactic, but it'll be a feedback session. So we'll have the results of the survey, but we'll have a discussion about what could be better next time and what worked well. So thank you, Rabia Khan. Thank you, Steve Kleiman, and thank you to our global audience of fantastic students. And I am just so delighted that we had this opportunity to talk about such an important issue at such a time. So thanks, everybody, and enjoy the rest of your day, as much of it is left. Thanks, guys. Bye-bye.